Hello, everyone. Welcome to the morning show. We're coming to you on Channel 9. We're also on WJOP-LP Newburyport at FM 96.3, and we're also live streaming on Newburyport Community Media's YouTube channel at ncmhub.org. I'm your host, Mary Jacobsen, and I'm just delighted to welcome today's guests who are here to talk about a really timely and important topic, and that's mental health in older adults. I've learned from them that a recent CDC study noted that 20% of people aged 55 and older experience some type of mental health concern. And that's just a jaw-droppingly large percentage of our population. So there are many, many older people in need. And given the worrisome number of older adults struggling with different issues, the Massachusetts Council on Aging has given grants to fund help. And one of the ways that one of those grants has gone to the Amesbury Council on Aging this spring to offer assistance to older adults who benefit from mental health services. And they've been working collaboratively with Link House and other community organizations to help older adults with mental health issues and substance use disorders. So I want to issue a warm welcome today to Sharon Roberts, who is the coordinator of Recovery Coach Services at Link House. Sharon, good morning. Welcome. Thanks for coming to the morning show.
Good morning. Thank you.
Great to have you here.
Nice to be here.
And Doreen Arnfield is also here. She is the director of the Amesbury Council on Aging. And Doreen, thank you so much for coming to the morning show. We appreciate you taking the time and offering your expertise.
Thank you. Thank you for having us. I love that we have the opportunity to talk about this issue. I think it needs to be talked about many times.
It's a really important one. That's such an astonishingly large number of people that are experiencing challenges and stress. So I'm glad to have you here. And let's start off. I was hoping that you could start by talking about some of the mental health issues that older adults commonly experience. And how they cope or don't cope, and perhaps some stories or examples that might illustrate the challenges or stressors that are commonly encountered by people in this age bracket.
Well, let me start off by saying, that number of people experiencing mental health challenges, think about it, okay, they're 55, 60, 70, 80, but maybe they already had those challenges when they were younger too. They're just continuing on. So that's part of it. And then some people develop those, the mental health challenges for a variety of reasons. Just like if you were younger, somebody older is no different. They're just older. They've just been around longer. So, and if I could start off too by just framing this with the Massachusetts Council on Aging and how it has supported this issue. We have an elder mental health outreach team that has been funded by the Massachusetts Council on Aging. I'll call it MCOA. Mm-hmm. And this is our 6th year. So this is nothing new. We started out one of 3 sites in the state as a pilot program because it was recognized that older adults need some support around mental health. And so this is our 6th year doing this. And this year we got a little extra money this spring. And that's when we had the opportunity to partner with Link House. So it only enhanced what we already have been doing. And I think it was a very timely thing to happen. So what we're seeing, to answer your question, I don't know, it's cut in if I'm going off topic or haven't answered your question, but we always, even before the pandemic, there is substance use disorders, there's depression, there's anxiety, like any age, but with older adults, I think in the generation that we're talking about, it wasn't always okay to talk about it openly, to access help. There's been this stigma that only has just recently been relieved, changed. So older adults, even though they're just like anybody else, only a little older, I think we want to support them maybe in a little bit different way, because we have to recognize, and I'm only generalizing, everybody's all individual and different, but we have to recognize that, that they might have a harder time asking for help, and they might feel a little shamed. And we don't, this is So many people experience this. And I think that's
Yeah.
what I would like everyone to know, is that you're not alone. It's not anything to be ashamed of. Let's address it. Let's give you some supports in place. And that's where Link House comes in. The person who runs our program is on vacation this week, Courtney Hutchinson. She is a licensed independent clinical social worker. So we have therapeutic means to help address this issue as well. So rein me back in, Mary, if you would, because I'm
No, what
all
you're
over
saying,
the place.
no, you're not. You're actually have a through line.
Okay,
In what
okay.
you're saying. You know, it's interesting what you're saying. Of course, people are human across their lifespan. As a friend of mine used to put it, things that show up in older age are sort of the same person, but more so.
Sometimes that is
And
the
so,
case. And
yeah,
especially if you haven't addressed it,
yeah,
possibly it's been underlying, it's been there, but you're taking care of your family or you're working and maybe you haven't addressed it. Or for whatever reason it comes out,
yeah,
maybe it didn't before, or maybe it has been there and you're just still trying to manage it.
yeah.
So there's all kinds of different scenarios.
Yeah. There's our common humanity, and we each have our different individual versions of places where we find stress and challenges, and things can feel a little overwhelming.
Yeah.
Well, Doreen, you mentioned the collaboration with Link House, and so Sharon, I was hoping that you might talk a little bit about your experience with Link House and dealing with some of the same question I addressed to Doreen, but you commonly encounter are problems that older adults find challenging, and the shape that your collaboration with the COA is taking.
Well, I started at Link House March 1st of this year as a recovery coach coordinator. And one of the reasons, this is such a great agency with a lot of talent, with a lot of seasoned as well as new professionals working in the field. I have always felt very strongly about being respectful and reaching out to older adults. The last place I worked specialized serving women over 45. And I think that it's been a very enriching experience. It has been slowed down the collaboration somewhat because of the pandemic and not really doing face-to-face, but we've done the best we could within the parameters of that. The Amesbury ACO, I've been so impressed with the level of commitment and collaboration with other agencies. I am gladly working with them. For about a year now, I volunteered for the first part. We were doing a free group on Wednesdays. We're still doing it for women, anxiety, alcoholism, which is SUD, substance use disorder, and depression. And we have kept the same 4 to 6 people coming every single Wednesday. When we went to Zoom, they showed up. I would say that it's mostly older adults, but in a couple of younger women, I'd say in their 20s, and they are very welcoming. The intergenerational contacts are enriching to both of them, all of them actually. And I would say as far as the recovery coaching, it's a less sort of in your face approach. It's more, I'm here, and try to find common ground to invite some conversation about what's happening now in your life. And I can't emphasize enough being gentle and respectful in the approach and making it more of an invitation than, oh, I hear you get a problem. Let's talk about this. I think, and so far it's working out very well so far up to this point. It's a real work in progress, and I am optimistic it's going to really be more of a need of this. It's kind of new up in this area, the Seacoast area right now, the recovery coaching.
Well, it's a great phrase, recovery coach. I like the sound of it, because it sounds like something that you work at and you kind of mentor and guide. But I was hoping that, Sharon, you might say a little bit more about how recovery coaching is different from other models. You said a little about that, the gentleness and the encouragement and inviting people into a conversation. But could you tell us a little bit more about say somebody was contemplating, well, maybe I could use a recovery coach, what would you say to somebody about what to expect from the kind of relationship they could develop with a recovery coach, and how specifically they might find it really useful?
Okay, first things first, when I approach somebody, I introduce myself. It's been via the phone so far. Actually, I have done a couple face-to-face, and I ask them how they are. Recovery coaching, if they ask specific questions, it's more about support. And how can I help you achieve goals that you may have? And if there's people that don't have any goals, we'll talk about what do you need to do? Is your health a concern? Social contacts. We really believe strongly that, and I know this is kind of a catchphrase, but it's connection is the opposite of addiction. So it's very important to get people connected in some sort of way, whether it's going to the bowling alley, going to a 12-step group, meeting for a cup of coffee, pretty much finding out, and I would say as you go more deeply into the relationship, is what do you love and what do you like to do? And what makes you thrive and what makes you, want to get out of bed in the morning. I think it's more positive. It doesn't have the title of a therapist or a counselor even. It's not quite as confining. I mean, we have people come to the center and they don't necessarily want a therapist yet, but they'll talk to a recovery coach.
Well, it sounds as though, I'm trained as a social worker myself, and a guiding principle of social work is meet people where they are.
Right.
And it sounds as though in a very friendly, warm, and inviting, totally non-pressured way, that's what you have to offer people. So if you have a goal, let's talk about it. If you don't have one, that's okay too, but let's talk about what you enjoy in life. And often I think that is, that's an intervention right there, because it makes people start thinking about positive things. And often people have been in a mode where they've been focusing on hard things or negative things. And so simply, it's like in solution-focused therapy, we shifted from starting out therapy by saying, what's the problem? Which gets people thinking about problems, to saying, what do you want?
Exactly.
What do you want to make happen? So that sounds like we could all benefit from a recovery coach.
Absolutely. If I could interject, I used to be a personal trainer, and so the model of the coaching, it's no different. A personal trainer, most of the time people want to lose weight, or they want to get more muscle on, or they want to eat better. It's no different. It's just a different area of focus to work on yourself. And with Sharon, she's great. There's no pressure. She treats people, very individually, and that's how we function at the Council on Aging. I used to be an outreach coordinator before I was the director, and the biggest thing I learned is, we're not going to generalize. We're going to treat everybody differently, because one person might thrive in a support group. One person might thrive better in a one-on-one experience, or without the pressure, or maybe some people thrive with the pressure and they need to be pushed a little bit. So we have to determine and assess individually. And I think that's what Sharon was alluding to as well.
Exactly.
Yeah. And but the other thing I take from what you've been saying, Sharon, which I think is really important, is people need connection. I mean, I think that what you said about connection and addiction, that they're kind of like the negative mirror image, or the positive of the negative, and then the like a photograph negative, and then the positive print of that is the connectivity, because connectivity, I think, is fundamental to what makes us human.
Exactly.
And so there's a therapeutic kind of a healing benefit, let me put it that way, to simply talking to somebody and opening up and feeling safe and welcomed while you do that. So thank you both for that. That was really sounds really like such an important and effective way of reaching out to people.
The opposite,
go ahead, Doreen.
The opposite of that is isolation.
Yeah,
that's what we base all of our work on as well, is even the introverted people who really don't care to join things. We try to encourage some sort of connection, you know, because isolation kills. We know that.
Yeah.
It causes actually physical ailments, and there's so many things around that that's just not a good thing. So connecting, even if you don't feel like you have any mental health challenges, connecting, that's why we do what we do here with all kinds of events and card games and live music and, you know, arts and crafts and whatever we do is because of we want to get people connected. And we find when people walk through the door, especially after this year, oh wow, it's hugs and smiles, and I'm so glad to be here. And so we all need that connection at any age.
Yeah. Feeling part of a community, that sense of belonging is so powerful and so much needed. So in fact, I'm glad you started us off on that track, Doreen, because one of the things that I wanted to ask you both to talk about is the impact of the pandemic on the issues we've been talking about. You know, we're just now, as you've been saying, we're emerging from, well, I've been calling it our bat caves, our cocoons, you know, and the last year, more than a year really, has been stressful on everybody in different ways. Some of them depending upon the stage of life you're at, some of them universally experienced by all of us. But in what ways have you observed that the pandemic has increased the particular kinds of challenges that older adults face? And how are Link House and the Council on Aging specifically helping older adults in transition back into what people have started calling the new normal?
I can say what I've observed so far and what I expected to happen. And I was a bit surprised. I thought when we opened up and everybody got vaccinated and it was okay to do whatever, I thought they would be pounding our doors down. I thought everybody would be joining everything that we have going on. And although we have a good amount of participation, we don't have what I thought we would have. So my theory is that I think people have gotten to their own habits over this last year and whatever, and have found other ways to hopefully stay involved, or they're just at home and they're having a hard time sort of getting themselves going to get out again. I think once they're out, they're really happy to be out. I'm kind of generalizing when I say they, but this is just kind of a hypothesis. So I think getting people back into the groove, offering those things that used to make them happy, I think that's what we're trying to do right now. I think it's habits. You know, you just develop habits. Even if it's been 15 months or so, let's say, it's relatively a short time, you know, comparing your whole lifespan, but I think you get into habits and it's a little tough to get out of those habits. So what we're doing, this was so timely because the idea is there's no one size fits all. So we're offering many different things. The recovery coach option is just a wonderful option. And I'm so on board with that because of being a personal trainer. I just get how people need to be accountable to others and need a little bit of hand holding and need that person, that phone number that person that they can call when they're maybe having a little bit of a hard time and they're on the brink and maybe they're just, Sharon might be able to sort of support them to stay on track. So there's the recovery coach. And then we have 3 support groups a week, which is more than we used to have. So we have a grief support group for those people that have experienced that devastating loss, especially during this pandemic, where they couldn't do the usual things to grieve. They maybe couldn't see their loved one as they were in the hospital or as they were dying. And then the funeral process was different. So there's the grief support group that we offer to kind of process that. We offer a substance use disorder group. And then we offer a caregiver support group for caregivers who are in this last year caring for their family members most of the time, many of whom have dementia or Alzheimer's or some other debilitating, chronic illness. And they've been doing it on their own, where typically we have a supportive day program here called Greenleaf Supportive Day. They would drop their loved ones off 5 days a week, 6 hours a day if needed. So that support wasn't in place. So now we're getting that back in. So did I mention them all? Grief, caregiver, and then the SUD support groups.
Yeah.
And then we're doing our usual thing. We have a couple interns here all the time, social work interns. So we're providing extra counseling and extra support that way. So I think it's just many different angles of approaching whatever it is people are experiencing right now. And the important thing is to let people know, and that's why I'm glad to be here on this show, is just to let people know that we are here. So when you're ready, give us a call, because we have connections with Link House. We work with Pettingill House here, a social service agency in Amesbury. We are very much connected. Courtney has developed so many relationships with the police, the fire, Anna Jake's Hospital, you know, who they make referrals to us. It's a back and forth partnership. So yeah, that's the message, really, is just to give us a call if you're experiencing something that you feel like you might need a little help with.
Yeah, absolutely. I love what you're saying about the formation of habits, and how I think that it is a process to get back in a kind of a different habit or a routine of reaching out and remembering that there is not only a hub of support, which COAs offer, but then there's folks that reach out, and you've been describing a lot of those folks. Even just to know, for example, that there are these groups available, that if you've been an overwhelmed caregiver, you know what, things are coming back in place. Access those services again, and also come and talk about what it's been like for you to be on your own with that huge responsibility. And there has been such grief of so many different kinds, and you were eloquent about naming the different kinds, Doreen.
Right.
And so it's reassuring. I think people need to remember there is a world out there. We've been in our bat caves, but the world is still there. It hasn't disappeared. But we have to remember what it was like, you know, because I think after 15 months of relying on our own inner resources and finding a way to cope, which, you know, we do, I find for myself, for example, because I'm like, who did I used to go out with? You know, where did I used to like to go? But I'll tell you that as I've started reaching out to people and saying, let's grab coffee, it's been wonderful. And we've picked up right where we left off. So those services sound wonder, and I'm glad that to have you here to remind people that the world has gone on and it's still there and you can pick up. So, you know, what about you, Sharon? Are there other things that you want to add about your observations about the impact, I guess, particularly maybe on substance use disorders of the pandemic?
Well, you know, the research says that drinking alcohol has increased over this past 15 months. That's not new news to us at this agency. It's the isolation. There was meetings, should the people choose to attend Alcoholics Anonymous or Narcotics Anonymous or Smart Recovery, they've been on Zoom, but nothing replaces face-to-face human touch. I saw a couple of women yesterday that attend our face-to-face group here at the center, and to like give somebody a hug and actually see each other. You can't replace that with anything else. And I just think, yes, we picked up where we left off, but I think that there's definitely a psychological backlash from this. And when was the last pandemic? 1917? I mean, I think that this is brand new to all of us. How do we adapt? How did we adapt? How did we survive it? And where do we go from here? And hopefully we come out a little bit more grateful for each other, and kinder and patient. And I think, you know, having the groups, I've been talking about the senior center. I hate that word, the center. And so
we're going to try to change it, Sharon.
Yeah, I mean, it's such a vibrant and lively place. So basically, we're here. I don't know if I really answered your question or if I went off course, but I will meet people at meetings, offer options, answer my phone anytime they call. So far, I do a lot of reaching out, but that's to be expected in the beginning, which is fine. I think we're coming out better for it. But, you know, some people did lose loved ones, and we weren't able, you know, to grieve the way we normally did. Even funerals, we weren't allowed to go in and pay our respects, you know, unless it was immediate family. So anyway, moving forward, that was tough on everybody, but
absolutely.
I'd like to comment on what Sharon said, and I agree. There are positives that have come out of this, and even though we're talking about mental health, and it seems like a very difficult topic, I'm personally, you know, saw a lot of positives, but there are a lot of people who struggled through it, but if we can, I think as a coach too, you know, I think if we can pull out those positives, even if they're the smallest thing, the appreciation of one another, the appreciation for nature and being outside where, as we had to be. And there's just, I think that's important too, is trying to fight the inclination to only see the negative. I think human nature kind of sometimes you know, makes us only see the negative in some cases. Some people are better at that, of the positive looking than others, but also adding what Sharon was saying about the process, and it's going to take time. And I do see that, we were a year with the pandemic, and now we're going into the second year. And I think it's going to take another year just to get us back into the groove. And whatever it takes, but community is in the center of that, and that connectedness.
Yeah, I think you're both on target talking about it's just going to take some time, because I think, you know, part of the nature of loss is it helps to verbalize it, but it also can take a while to realize, because we do adapt, what we've missed or where the gaps are. It's like when a family member dies, for example, it creates a gap in the family. It might not be the one that you expected. It certainly might not be the person you anticipated would have such an impact, but over time it becomes clearer to you what role that person played. And that's when, sometimes a little bit after the initial loss, that you start really coming to understand what you feel like you're missing, or where that gap in the air where the person used to be is. And I think the same can be true of our community at large, and also the different communities that we belong to, whether it's a church or a social club, whatever it is. So I like what you're both saying about it. It's an ongoing process, but also one that you're both positioned to help people.
and it's in stages, right? What you're describing, Mary, is stages. That initial, and then secondary, and third. And and isn't it always how we appreciate people after they've passed, right? It's you're the best person in the world. You know, you have a different, it's funny how that works.
Well, I wanted to ask you both, what are some of the signs for people who might have a family member or a friend, that to look for? What signs to look for that somebody may be struggling? And now that you may be seeing them more often, in more context, it may become clearer to you that this person really is struggling, whether it's a substance use issue, or depression, or I know, or what might look like an incipient dementia of some sort. You know, what are signs for people to look for in a friend or a family member that, you know, I think there might be something deeper going on. And of course, paired with that, then what can people do? What can they say, or how can they be helpful to that person?
Well, I'll start, Sharon, and then
Please.
you can, because I want to start broader, because mental health is not only about substance use disorder, you know, and addiction, although this is what we're talking about a lot here, because we're, you know, linked up with Sharon's agency. And the MHOT program, Elder Mental Health Outreach Team, really works with people with schizophrenia, depression, anxiety, all kinds of mental health challenges, large or small. And what we look for in general is somebody that's isolating somebody, or they're different from what they used to be. So if you have a loved one or a friend or a neighbor who typically used to go out every day for walks or sat on their front step with a cup of coffee, and now you don't see that anymore. Or you haven't seen that person around in a while, or that person doesn't call you, or you don't talk to them as much as you used to, or just changes in their usual habits and their personality is what you might look for. And some people will be very upfront about how they're feeling and reach out for help, but it's the ones that don't, and there's a lot that don't. It's just kind of checking in. Check in with that person. If that person you haven't talked to that person in a while, and you might think to yourself, oh, they're just busy, it's no big deal. Just make that effort, I think, to check in with them and say, how you doing? Just how you doing? And hopefully they will open up a little bit if you have a good relationship with them, or find somebody that does have a good relationship with them and get that person to check in. Sometimes, one person will have a better connection, like even here at the senior center. One of us might have a better relationship with a client or a person than another for whatever reason.
Yeah.
And so you just find that person and check in with them.
Well, I think your idea about being attuned to differences in how somebody used to be and how they might observably behave differently, or it might feel like a different kind of connection or a lack of connection. I think that's a really important attunement to suggest for people to utilize that spidey sense.
And if your gut tells you, if your gut is saying something, but you can't put your finger on it, listen to your gut and just, what's the harm in reaching out, right?
Exactly.
Unless you're reaching out, too many times, like all day, every day. That's not good. Yeah.
But checking in, as you say, or if you're not sure how welcome your check-in might be, you might know somebody that has a good connection, and you might also be able to facilitate contact. Because a theme throughout our conversation today has been the importance of connection and community. So, Sharon, did you have anything you wanted to add about what to look for?
No, exactly.
Yeah.
I'm sorry to interrupt.
No, that's okay.
Exactly what Doreen just said. You see the changes, pick up the phone, reach out, and exactly. I often work with a couple of other people. If I'm not connecting with the person so much, I will bring somebody else in. It makes a huge difference.
Yeah.
But
and don't be afraid if that you're bothering them. Sometimes that's how personally I don't want to bother them, but don't be afraid to bother them. And if that person is saying, don't bother me, well, if that person would never say that in the past,
yes,
then that in itself might be a little a hint.
True.
Totally. Yeah, exactly.
Well, I'm curious to find out. It's clear that there are lots of services available that people can access. And kind of as a follow-up to what we were just talking about, if you were talking to somebody who was maybe on the fence, say, about, I think I'm going to call Link House and get a recovery coach, or I think I'm going to wander over to the senior center. What might each of you say to somebody to just nudge them a little bit off the fence and onto the side of connecting?
Do you want to go first, Sharon?
No, please go ahead. Go ahead, Doreen.
Okay. All right. So so we work with people. There are some people we work with on a regular basis, weekly. We talk to them weekly, or they come in here weekly, and others we work with maybe monthly, or all different levels. So if that person is we might just continue to check in with them. If they're saying, yeah, maybe I will, I'm not sure. All right, well, how about if we just check in with you next week and we'll see.
Yeah.
So then, and eventually the timing might be right. The weather's changing. Hi, Kate. So I think you respect their decision. It's ultimately up to them. But you're always there, and you just want to, when you're ready, we're here. Here's a newsletter. This is what we're doing. Sometimes I'll try to find a common ground and look in our newsletter, like, oh, what do you like to do? And I'll look at our events and see if I can connect them that way. But ultimately it's their decision. It's their life. And we're just there to help support what they want to do, what makes them happy.
Yeah.
And purpose. you know, I want to say something about purpose. That's underrated. I mean, purpose is everything in my view. Everybody needs a purpose, and whether that's helping somebody else, whether that's volunteering, whether it's working. Yeah, I wanted to insert that somewhere.
No, I couldn't agree more that I think feeling like you have a reason to channel your energy into something that feels constructive and helpful. And, you know, that is accessible to all of us because you can always smile at somebody, you know, you can always find a way to be kind. And so, and that is, that works both for purpose and connection. So I want to welcome Kate Dodge, who had some car difficulties. But we're happy to have you here, Kate. So Kate Dodge is the Center for Behavioral Health and Addiction Treatment Services Program Manager at Link House. So Kate, you're welcome. Hello, how are you?
Sorry for my tardiness, and I just jumped in hearing about purpose and with the senior population, but also Sharon may have already mentioned this, but purpose for people in the recovery world is huge too. So tying that together is like a dual purpose is the word, I guess. So it really, it's huge. So, and kindness, I loved what you said about that. So I'm not sure what you wanted me to say, or if Sharon's already kind of introduced Link House, but
yeah, we've been having I'm so sorry that you weren't here to contribute to, because I know you'd have had excellent things to add, but we've been having a wonderful conversation about the different kinds of issues that people experience before the pandemic, after the pandemic, and just in general, the importance of connection and all the different programs that are available, you know, both through the Council on Aging and both through Link House. The one thing we were just talking about before you came, Kate, just to see if you have anything to add, is we were talking about how earlier Sharon and Doreen had been talking about how there used to be, and is less now, a stigma attached to accessing services, especially mental health services. And, you know, they talked about how it's gotten a little less stigmatized. So we were just talking about how to help somebody who might be on the fence about accessing services, whether it's a recovery coach or whether it's going to the senior center to participate in a grief support group or another kind of group. And I'm curious to see what you might have to say about how would you talk to somebody to encourage them to, you know, go ahead, you know, to get them kind of off the fence and into the senior center or on the phone with Sharon. Yeah. Or you?
Well, I can say that we're very excited to be collaborating with a group like Amesbury Council on Aging and hope to like expand to others. And I think you mentioned kindness, Mary. Yeah. That's a great approach in my mind. I've had many people I've worked with say like, you were nice to me. And you know, it's a much warmer, that whole warm thing is huge. And knowing a little bit about Doreen from my recent experiences, and Sharon I've known for a lot longer, I would direct anybody to both of them because I think they could gently get people involved in mental health. And then we provide the service here, which is wonderful. But these two women, just especially with the senior population, they're non-threatening, they're not pushy, they're not you have to do this. It's just, I would direct them that way, or I would talk to somebody myself. I'm a licensed alcohol and drug counselor also. So when it comes to the substance issues, I'm very comfortable talking about that. But I think just gently is the word to get people, especially the senior population where mental health services weren't as accepted. Yeah. I can speak for my own family. And then the substance issues with the stigma. So it's kind of, I like to be a little more open about it too. And maybe people become more comfortable in breaking down those walls. But I really think we have a great group of people in this community, number one, and then in our agencies collectively too. So it's, I know I feel confident sending anybody to Doreen or Sharon or Courtney that Doreen works closely with. And it's just, they do great work. So
Thank you, Kate.
Yes, they've shown a gentleness and a real warmth and wisdom as we've been speaking this morning. And you've just underscored that, Kate. So thank you for that. Well, I have two more questions. One of them is logistical, but I'll save that for the end. But the other one is, we've been talking about coming out of the cocoon of our pandemic and the changes, how challenging it's been and how wonderful it's been to come out. So I'm just curious to find out, what have each of you yourselves found has made you happiest or most joyful as you've been able to take your mask off, either at work or personally. Who would like to start?
I will again. Personally, being able to have the mask off, to see everybody's expression, to see their smile, to not feel restricted, to be able to invite people in. What we do, all of what we do is to be warm and welcoming, and we had to shut that down. Yeah. So now our doors are open again. It doesn't have to be by appointment necessarily. It's come on down. Seeing more and more people, seeing them happy, hugging each other, just that freedom, just that non-restrictive freedom of coming and going as you please. And that's what's made me really happy.
Yeah. I'll bet. Yep. Being able to see people's smiles is so powerful.
Yes, really is. So there's the positive of how you appreciate things that you never would have. Would you have said that, 15 months ago? Would we have said, how a smile is that? Maybe a little bit important, but not now.
Now it's highlighted. Now it's foreground. It might have been background before. Yeah. Sharon or Kate, what about you?
Kate, after you.
I play hockey a few times a week, and it's been so nice to play and see people smiling. This is personal, obviously.
Sure.
To be back out without a mask, under my mask, it's been great. So it's seeing people's whole face. It's just, it's amazing what you miss in the expressions. So it's, professionally, we're really looking forward to having people start coming back in, because I think you probably, Sharon, I know Sharon talked about connection. She always does.
She was eloquent about it.
She is. She's great. And our clients, our patients, whatever we call them today, they need the connection. They need that sense of community. People are lonely after this pandemic. So having people, I can't wait for the people to come in. That's the lifeblood of this whole kind. It's been a ghost town throughout COVID, and I don't like that. So I can't wait. And it will be nice to just walk in. And if somebody's struggling, to be able to walk in and say, can you help me? When Chris and I set up this clinic, we wanted it to be a place people can just a resource. Like, I need help. Can you help me? So
Chris has been on the show before, and I know her, and this was pre-pandemic, and she would say, just stop by. Right. Just come in, say hi, we're there. Yeah. So I'm sure that you're looking forward to being able to return to that. So Sharon, how about you?
I agree with what everybody's saying. I mean, we lost some spontaneity, being able to see somebody smile in their full expression, or giving somebody a hug or receiving a hug. That can't be overemphasized, how wonderful that is, to see a full expression on somebody's face.
Yeah, there's no substitute for it. Yeah. Well, thank you all so much. This has been wonderful. The logistical question that we must end with is, so what's your phone number?
We have time
to find you. We'll end on that.
Do we have time for just one final thought? I wanted to get out there.
Yes,
okay,
absolutely.
So I will say my phone number so I don't forget. It's our phone number here at the Senior Community Center in Amesbury is 978-388-8138. But I just wanted to also say that we are, I am part of a age-friendly task force initiative, and there's different communities in Massachusetts and around the country that are designated as age-friendly. And I want to put it out there that this is an initiative that we're trying to, and then this mental health piece that we're focusing on today is only one piece of older adults and what we do. And I want to say that the connectiveness that we talked about, the purpose that we talked about, and the respect is important across the age spectrum.
Yeah.
We're just talking about it because this is what we're talking about today. But everybody wants to be respected. Everyone needs connectiveness. Everyone needs purpose. So and so I'm trying hard to reduce that stigma of the mental health piece, because we all face all of these things. Everybody has, everyone knows somebody that might have a substance use disorder. Everyone knows someone with a mental health, you know, just look at your families. We all have it.
Yes.
So we laugh about it, but we all have it. So let's just say that we have it. Let's do something about it. Let's just treat it as another, you know, something that we just have to address. That's all.
It's proof that we're human.
That's all. Yeah.
Yep.
Right.
Well said.
Thank you, Mary, for that opportunity.
You bet. Thank you for clarifying that. Appreciate it. And access to Link House. How can people
Our
find
phone
you?
number is 978-834-6583. That will ring to the main number, and you can access any of the clinicians. The front desk will take your call, and I'll call you back within 24 hours. We're located at Boston North Technology Park in Amesbury on 110 in Building B. So come and see us.
And that's a good point, Kate. Thank you for reminding me. We are at 68 Elm Street.
Great.
In Amesbury.
All right.
Well, Doreen, Sharon, and Kate, thank you all so much. It's been wonderful to learn from you on this important topic. And it's clear to me that you're doing really impactful work in a gentle, kind, connecting way, which, as we've said, is what our souls all need always. So thank you all for visiting the morning show. I really appreciate it. It's been wonderful to have you here.
Thank you.
Mary.
Thank you, everybody. Take care.
My pleasure.
Thanks, everyone.
Well, thanks for watching, everybody. That's it for this morning show. I hope you'll join us next Thursday at 9 on Channel 9 for the morning show. If you missed any part of today's show, it'll be available for viewing on Port Media's YouTube channel playlist for the morning show. Just go to ncmhub.org, click on the YouTube icon, and scroll down. Each show will also air on WJOP FM 96.3 on Friday at 8 a.m. and the following Tuesday at 4 p.m. and Wednesday at 3 p.m. It will also be available as a podcast on the SoundCloud. Just go to ncmhub.org and click on the cloud icon in the upper right-hand corner and then scroll down. See you next Thursday, everybody. Bye, everyone.
Thank you.
Bye-bye. Thanks.